Hi, I'm Dr. John Young at Foundational Health Center here in Largo, Florida, and we're back for part 2 of stroke treatments. Last time we talked, I talked about the use of Enbrel in patients with strokes, brain injuries, things like that. And why we like it is because it works very, very fast and it's very successful, about an 80% success rate. Now, there's more than just one thing, Enbrel, when it comes to strokes. Other things that we've been doing that have made the stroke treatment, I think, even better is that besides the Enbrel, we also use umbilical cord stem cells. This is from the tissue banks. Umbilical cord stem cells I love because Enbrel stops the inflammatory process, which you see in all these brain injuries. Number 2 is umbilical cord stem cells have the ability to become brain tissue. They can become neurons and all the parts that make up the nervous system in the brain and in the spinal cord. So what you're doing is you're actually putting in the stem cells into the central nervous system, and I give it through the vertebral vascular system, and you can actually get the stem cells right close to the brain injury. The closer the better, you might say. And I've seen this in my own daughter who has Down syndrome, not a stroke. But what's been interesting is how within 72 hours, almost to the second, we give her stem cells, you see this big jump in her mental ability because stem cells help make new neural pathways in the brain. So stem cells have really become a very, very big part of our overall stroke treatment. Another part of it is human growth hormone. Now, when people think of human growth hormone, they think, John, first of all, I'm not, 14 years old and I don't want to grow to be 9 feet tall. We're talking about low dose. And I'm not trying to turn you into Arnold Schwarzenegger with huge muscles and things like that. But low dose human growth hormone is very, very interesting when you go look it up, Google it or whatever. But in the brain, it also helps with the construction of new neural pathways within the brain, whether you have Downs or certain brain injuries, strokes. It helps with that recovery process. I can just say this for my own daughter, that before she got human growth hormone, the conversations were, let's get out of the pool. And she would cry and complain. Now it's ask her to get out of the pool. Why? We're going to go shopping. I don't want to go. Well, there's no one going to watch you to swim. She says, well, I'll get my brother to watch me. In other words, she reasons out. And that has been very, very enjoyable. Sometimes we have to get into big arguments. But to see this girl who, before we started the human growth hormone, her ability to do that was very diminished. And even in the stroke patients that I've used human growth hormone, I've noticed, and the family has noticed, their ability to think starts to really become more normalized. Human growth hormone, along with stem cells, I think is very, very important if you're going to try to get this stroke recovery back 100% to normal. And by low dose, we're not doing high amounts of human growth hormone, but it would be about 6 insulin units on a needle, given subcutaneously either in the lower abdomen or the anterior thighs. You pinch the skin. You don't even draw blood when you give it. It's just under the skin. Monday through Friday, take weekends off. You're going to be doing it for maybe 4 to 6 months. And everyone we've done it on, the families have been greatly encouraged, the patient has been greatly encouraged to see that they start to really get better faster than the others who've been going through the traditional treatment. And once again, we love traditional treatments, but if you're not happy with where you're going with traditional treatments, you need to think outside the box. Enbrel, umbilical cord stem cells, human growth hormone, all really viable options in trying to recover from a stroke. I hope this is helpful, And we're going to be coming back with part 3 here in a few weeks, and just letting people know that there's a lot of things out there that they can do to get better sooner with any type of stroke.